So let's just go over sort of the learning objectives today. So everything that I'm going to talk about is really based on review of empirical literature, but I'm told that I've gotten a little bit, I can get too technical sometimes, so I'll try my best not to get too sciencey on you, and try to help make sure things are relatable. But first, I want to discuss the rates, risks, and reasons of concussions and the rates in which concussions are reported, as well as looking at factors that influence concussion reporting, the efficacy of concussion programs, and then application, like what to do to help increase concussion reporting. So I wanted to get another quick survey just out of curiosity. When you hear an athlete is not reporting their concussion symptoms, what's the first thing you're thinking? Why? Just anybody, just yell it out. They want to play, yeah. And a common answer that I've gotten from other trainers and coaches is that they're lying, and in a lot of cases they like Kira, they may, who's the second athlete that we heard about, she may minimize her symptoms, although it may not always be 100% intentional, as we'll see. And that can be helpful in parsing apart what's going on. So here's a lot of what the athletes that we just heard about talk about are very similar to some of the things that I've heard in my clinic. So from student athletes, when because I'm seeing them, like, they've been out of sports for a month and a half, and I'm asking, like, okay, so what was going on? You had this concussion, but it looks like you didn't say anything until 2 or 3 days later. Did it have a delayed onset of symptoms? Because a lot of times you'll hear a delayed onset of symptoms, and yes, that can be the case. But when it's a delay of onset of several days, the more days, the less likely it is the concussion, because you're not going to have that slow onset of symptoms. But some of the things that I'll hear are, and this is I know we have a few coaches in here. My coach says we better really be injured or just quit now. Or I was called too chicken to play. I didn't want to let my teammates down. I need the stats for scholarships. We have a lot of really competitive athletes sometimes, and not being able to return to their sports can really affect their life. People will think that I'm faking. I've been accused by teachers that I was trying to get out of homework and tests. So these are prototypical types of responses that I've gotten, and I want this presentation to kind of address all of these. So so it's been looked at pretty thoroughly in the research, the rates of concussion symptom reporting, and at the time of the concussion. So, but the research will show that less than half of all concussions are reported at the time. Some of them are reported after the game or later on the next day. But still, we're looking at a pretty sizable portion of kids who are not reporting their concussions. Anybody here work with adults, not kids? No? Okay, good. So this should be pretty relevant, except for you and the neuropsychologist. So many athletes do report that they just play through it, despite the risks that are inherent to playing through it, including having a longer recovery time, slower reaction time and balance problems, and increased risk of knee and ankle injuries. So let's look at those reasons, or those risks, a little bit closer here. So first of all, we do know that from the research that concussed athletes who do not come out of play at the time have significantly worse neurocognitive symptoms after their concussion. They're almost 9 times more likely to have a protracted recovery. So those are significant headaches, balance and dizziness problems, memory, concentration difficulties, lethargy, irritability, that goes on for a longer time than at the typical recovery window, which in most athletes is 7 to 10 days, but it can range in younger adolescents. It can range up to to 3 or 4 weeks, but still 9 times more likely to have a protracted recovery. And then they actually have a double the recovery time than their peers who report the concussion when they get it. So when you think about it, as Kira mentioned, her concussion took 6 months to recover all together, and that's pretty remarkable. And it could have been she could have had a shorter recovery time if her concussion was managed differently. But missing 22 days is you're missing 2 or 3 games. But missing 44 games is half the season, if not the entire season. So, in trying to understand how to get student athletes to buy into concussion reporting, it's important to keep in mind what's important to them. They want to get back to play. They want to play, right? So it's important to remind them that it's better to miss 1 game than the whole season. Like our athletes that we heard earlier, they seemed like they learned that, but they learned it the hard way. So the take-home point here is playing through it results in a longer recovery time and more missed games, and that's what will resonate with our athletes. Risks of playing through the second main point is that it really affects how you play. Athletes play concussed athletes play with a much more conservative gait and approach to playing. They have decreased postural control and motor planning, and they have slower reaction times and decreased attention. So. Just like our first player said, he wanted to get back in to the football game. He was really wanted to get back in. He wanted to help his team and win the game. But when he did so, he found that he missed the pass. He was not playing the same. So going back to play is not necessarily going to help your team. So it's better just to. In fact, these athletes might actually make mistakes that cost their team the win instead of just staying out of the game. And recovering. So this is the second main point. But this also relates to something that's more important. So if these athletes are playing with slower reaction times, they're not paying attention, they're sluggish, so they're not protecting themselves as well as they usually would otherwise. There's an art to taking a hard tackle and without getting injured, and they're having balance and dizziness problems and coordination difficulties. So that's going to affect how they're moving, and is going to increase the likelihood of lower extremity orthopedic injury. In fact, there's roughly 3 to 4 times more concussion to have ankle or knee injury after a concussion than before. So the concussion does place athletes at much higher risk for other injury that can be a season-ending injury, and maybe even sometimes, in some cases, a career-ending injury. Like ACL breaks are, as you guys know, are no fun. So playing through it can result in a season-ending injury. So those are 3 major take-home points that I'll review later that can be used to get through to your athletes. So this is where psychology comes in. Is like how do we really get through to teenagers and get them to do what we want them to do. As we know, teenagers don't even have to be concussed to have poor decision making. So so we're working like against the grain here. So as I think Mark mentioned in his presentation earlier, you went over like what are the athletes' concerns? What concerns them about concussion? And it was fairly equal that they were concerned about the post-concussive symptoms, but just as much loss of activity. So it's not just the symptoms and the pain, it's the consequences of the concussion. Because really, when an athlete gets a concussion, the concussion management is not viewed as a way of helping them. It's viewed as a punishment. They cannot help but experience it as a punishment. It creates psychological distress to be removed from your social circle and where you get social reinforcement and where you derive a sense of pleasure and self-efficacy from a sport that you've been practicing at and trying to get better at. So that was for emphasis. So to take it a step further, then the reasons, what the concerns about concussions, but there's one really good study that looked at a large sample of community college athletes to examine the reasons why they did not report the symptoms. So they used what's known as the Rosenbaum Concussion Knowledge and Attitude Survey to assess degree of change before and after. And they also did interviews and sort of just qualitatively analyzed the athletes' responses. Now there were of this sample of almost 1,000 athletes, 36 players who were concussed did not report their symptoms. So of these, the players did not express awareness of the risks. Of this percentage, the players did have awareness of the risks, so they knew what the risks were, like factually, and they understood the seriousness of the consequences. So it wasn't because they didn't understand. And this is also reflected that their knowledge index their concussion knowledge index was actually higher than the reporting group, and that did not predict them. So knowledge did not necessarily mean that they were going to report their concussions. And even so, history of previous concussion was not in this sample, it was not predictive of concussion reporting. So for example, like in the case of the athletes above, the interviewer asked, so next time if you get a concussion, do you think you would report it? And they said, oh, definitely, because they know what it's like to go through it. But again, not all concussions have a really protracted recovery. In fact, that's the minority of about 10 to 15% of athletes may have a more protracted recovery. But roughly 80% have a pretty normal recovery of 1 to 3 weeks, such that the consequences may not sink in as much. So past experience doesn't necessarily increase risk. But so the reasons why the players didn't report their symptoms were really classified into 3 different clusters. The first is physiological response. So this is best. I think this is best summed up by thinking about them being in the zone. So the way it's been described by a few of the respondents in that research study were, I was fully engaged in competition, or this is when they're fully engaged in the competition, but they're relying on instinct. They're not thinking. They're just doing. So they're really in the moment. And when you think about it, that's how athletes are trained. If you think through every individual step, you're not going to react as quickly. You're not, you practice the steps, and you're thinking a lot about it then. But then when you're performing, you're just going. You are relying on instinct and reflex. One athlete said, "I just kept going through and didn't realize it until after the game, and then I just felt awful." So what happens is especially in a highly competitive game, there's a lot of adrenaline going, such that which accounts for delayed onset of symptoms. It's not because they're not having the symptoms, but because they're not feeling it at the time. They're not perceiving it because adrenaline is blocking those pain receptors. But then after the game, they certainly feel it. So that's one reason. So that physiological response can really result in delayed onset and reporting of symptoms. But still, other people can see how they're playing, how they're a little bit more off. They can be disoriented. They can be confused. That's a symptom of a concussion. And you do not have to be knocked out to have a concussion. A lot of times people have concussions and have what's called post-traumatic amnesia. That's when they're up and walking around and responding, but they're not remembering anything. They're not tracking events. So But and those kids, they, if you talk to them, they may seem a little bit confused or give nonsensical responses. But sometimes if people aren't watching out for them, then that can go unnoticed. So the second cluster was attitudes. Now, this doesn't mean like positive or negative attitudes for or against concussions, but this means attitudes in regards to how they're evaluating themselves and their commitment to their team. So, for example, the self-evaluating of symptoms, that's when athletes take a hit, they say, hey, I just got hit. I wonder if I had a concussion. And they start asking themselves questions. Well, I know what day it is. I know what my coach is telling me. I'm not throwing up. I think I'll be all right. And they keep playing. That's actually a pretty rational thing to do for a rational person. But when you get if they are concussed, then they're not necessarily aware of how they're thinking. And they may not. And they may be exhibiting symptoms that moment that aren't really registering with them at that time because of that physiological response and adrenaline. The second piece would be the sense of commitment and sense of duty and commitment to their teammates, and that's a huge piece that's going to come up over and over again for the rest of the day, just because it's that important. So players are more likely to look out for the welfare of their teammates than for their own health. So, a lot of the responses were athletes were committed to the team, they care about their teammates, and some athletes in this paper actually refer to their teammates as family. So, that really does underscore the loyalty that's involved. So it's a very admirable trait, but it can be, you can be loyal to a fault sometimes. But this is important because it does bring up a finding that's been mentioned in several other studies, and that is that increased concussion reporting is associated with being urged by teammates. So again, we're talking about teenagers. Developmentally, they are in a peer, their strongest influence is their peers. So if their peers are calling them chicken, or they don't want to be supportive if somebody's hurt, then everybody on the team is going to be less likely to report it if they're hurt in any way. But if it's the other way, where teammates are urging them to report, then that's going to be helpful and increasing the rates of concussion reporting. The third reason is just straight denial. So this means that athletes are not only denying symptoms to their coaches and athletic trainers, but they're also they're also denying it to themselves. And there's actually, so this is beyond just the physiological reasons for not feeling the symptoms, but this is actually embedded in it's a prime example of a psychological phenomenon called cognitive dissonance. So cognitive dissonance is just when if a person has two beliefs that contradict each other, then one of those beliefs has to give. So it's pretty simple. So whichever belief has the strongest anchor is going to overpower the other one. So in the case of an athlete with a concussion, higher level of loyalty to teammates actually predicts not reporting their symptoms because of that cognitive dissonance. I think I have a concussion, but I don't want to let my teammates down, so I don't have a concussion. So that's a kind of a split-second psychological process that can go through and explains why some athletes may not report symptoms at the time. So now, what about reasons why players do report symptoms? So interestingly, the largest percentage of the study stated they responded, "I didn't feel well and needed to let someone know." So that's an interesting answer because it doesn't rely on a whole lot of knowledge. It relies on procedure, which will be important, as we'll see in a few minutes. Others cited previous concussion education as reasons. So, they benefited from the concussion education programs, and other respondents reported urging of teammates, as we already established, was an important factor. So, sports cultures. So this is another an important factor that can really help. That can help all the coaches to really take advantage of the athletes' loyalty to their teammates and desires to take care of each other, and that. By simply creating a reporting-friendly environment. The Institute of Medicine and National Research, so it defines sports culture as encompassing coach attitudes and social norms inherent in sports, and it actually, and other researchers have really established that social norming and the concussion reporting environment are integral considerations to be integrated into concussion education programs. So ultimately, when coaches and athletic trainers, when you guys encourage your your athletes to report their symptoms, then that can just create that environment in which they feel safer to do so. Some of the quotes from before, the one about you better really be hurt or just quit now. Some things like that can just be tongue-in-cheek comments, that aren't really meant to be taken that seriously, but can still, but sometimes athletes can can latch onto that, teenagers especially. Emphasize to your players that, so by encouraging players to report, you're creating that environment. Also, you want to avoid that self-evaluation and remind them if they're evaluating themselves if they had a concussion, then it's probably worthwhile to be evaluated by their trainer or coach or somebody on the sidelines. And then also just emphasize those reasons for the risks associated with playing through it, being longer recovery time, worse playing, and increased risk of more severe injury. So to really, again, to capitalize on the social norms and the strong social influence of student athletes, emphasize playing as a team. And remember that symptoms don't always start immediately. They can be delayed, but so the individual may not report them, but their teammates may recognize them. So symptoms don't always start immediately, but players don't realize they're concussed. But if you teach their teammates to recognize, to watch out for concussive symptoms in their peers, then they can help spot it when it happens and urge them to go get checked out. So it really does underscore that it's not just an individual thing; it's still better for the team. You have better players on the field when they're not concussed and disoriented. Now, aspects of fear to report culture can occur not only on the field but in the classroom, and this is something that I've dealt with a lot as well. And to make things brief, like for school nurses, I find that it's always good to have one identified contact at the school to communicate regarding post-concussive symptoms. And having school nurses be a liaison between the students and the teachers can facilitate their teachers understanding their symptoms and follow through with concussion recommendations and return to learn guidelines. So I'm going to briefly. So I'm running short on time, so I'm going to hit on some of the main factor, which is the concussion education. So the NCAA mandates annual concussion education. Now you guys all have that this year. Concussion education is provided to 70% of all sports, and most of which are football players. Athletic trainers, you guys do the majority of concussion education, apparently. Coaches, you guys are next up to bat, and then doctors, family, friends, and social media. Most concussion education is delivered via lectures and presentations such as this, but also handouts, one-on-one conversations, and online trainings. Now, what these have in common is they're all didactic methods. You're learning facts to learn about concussions, and that has implications. So this does beg the question as how effective is our concussion education programs. So education does increase student-athlete knowledge about concussions and increase their knowledge on how they're supposed to manage them. So in that case, yes. But other studies have questioned the efficacy of concussion education programs in actually increasing the likelihood of concussion reporting, and have found, as we've seen earlier, that concussion knowledge does not necessarily transfer to concussion identification in that heat of the moment. So in that case, no. So, because remember, they're in the game such that that previous education is not necessarily readily available to them. This is largely because of what we call state-dependent learning. And that's basically that you remember information better when you learn it in the same context and the same physiological state as you have to remember it. So if you learn information in a classroom, you're not going to remember it and apply it very well on the field when you're in that heat of the moment in the zone mode. Lectures and online trainings are declarative memory. However, practice and games are what we call procedural memory. Now the good news is procedural learning strategies is something that we do in neurorehabilitation with more severe brain injuries all the time, and it can be much more effective because you don't have to remember facts, you just have to remember how to do something. So declarative memory is impaired by the acute neurometabolic effects of concussion, and it's but the good news is that declarative memory is not reliant on those memory impairments that often come with a concussion. So to apply this to something applicable, procedural learning strategies can be integrated into existing concussion education programs. So for example, you can start with the standard didactic lecture on concussion, but then after the lecture, after you cover all the relevant information, the team does non-contact drills. And the athletic trainer uses a light to signal to a designated athlete that he had a concussion. The player provides a gesture such as patting himself on the helmet to his coach to pull him to the side. The player comes to the sidelines and uses a previously agreed upon phrase, "I think I need to be checked out." So it's simple, but it provides that procedural learning that can be repeated several times to provide that experiential learning in the context of playing on the field. So that's something that shows a lot of promise for increasing concussion reporting in student athletes. So just the main take-home points here. So most athletes do not report concussion symptoms immediately, despite knowing the significant risks, which, as we recall, are longer recovery, more severe symptoms, and missing more games, and then also possibly a worse injury. There are many different reasons that athletes don't report, and they're not necessarily always lying or minimizing, so it's important to understand those reasons. They can be delayed symptoms, team loyalty, and social pressures. Some things are sometimes positive things can be negative, like the team loyalty in this case. The reasons that athletes don't report could easily be the same reasons that they do. So team loyalty, I don't want to let my teammates down. So you turn that around, get the teammates to watch out for each other to keep them from getting injured. If the athletes perceive that they're not allowed to get hurt or report symptoms, then maybe their coach and athletic trainers can address that and encourage them to create a more reporting-friendly environment. Just to emphasize it is important. And then encourage your athletes to recognize and report symptoms in their teammates. Concussion education is important, but must incorporate applied practice. Lastly, this sort of ties everybody in the room together, in that concussion management requires communication between all adults, teachers, coaches, athletic trainers, physicians alike, across all settings. So that's all I got for you. If you guys have any questions, I'd be happy to talk.